the grandson of a doctor and the son of a doctor, Jon K. Andrus was born into a tradition of service to people's health. Growing up in California's Salinas Valley, he went on medical rounds with his father, L.H. Doc Andrus, a passionate advocate for primary health care. After graduating from Stanford and studying medicine at the Universities of California at Davis and San Francisco, young Dr. Andrus began his career as a primary care doctor in underserved rural communities of Northern California. In the mid-'80s, he took his skills abroad, joining the United States Peace Corps in Malawi. He worked out of a clinic that had no electricity and no running water. Returning home after 2 years in Africa, he was hired as an epidemic intelligence officer at the Centers for Disease Control and Prevention. 3 years later, the CDC seconded Andrus to the Pan American Health Organization, in charge of polio surveillance in PAHO member countries throughout the Americas. At PAHO, Jon Andrus became a key member of a world-class immunization team that helped the Americas become the world's first region to eradicate polio. That success led the World Health Organization in 1993 to recruit Andrus to coordinate polio efforts in 10 countries of Southeast Asia.
The best method clearly is a pulse immunization or a mass campaign, as we refer to the distribution of vaccine to all children on a particular day, reaching as many children as possible.
Andrus persuaded the countries to carry out national immunization days, a tactic that had proved key for the eradication of polio in the Americas. By 2000, more than 250 million children had received 2 doses of oral polio vaccine. Thanks to these efforts, much of Southeast Asia would soon become polio-free.
This is being done in the nation's capital may prove to be a turning point. This may be the beginning of the end in terms of polio eradication, at least in Southeast Asia.
When he returned home in 2000, Jon Andrus was honored with his country's highest public health distinction, the Distinguished Service Medal of the U.S. Public Health Service. It would become one of many such honors in Dr. Andrus's 30-year career. Since 2009, Jon Andrus has served as Deputy Director of the Pan American Health Organization, working to advance the health of people throughout the Americas. Under his leadership, new vaccines have become available in countries that, in the past, had to wait years to be able to afford them. A staunch friend of Haiti, he has marshaled support to expand access to water and sanitation, to eliminate cholera and other waterborne diseases. A firm believer in Pan-Americanism, he has built lasting partnerships that are helping PAHO advance the common goal of improving the health and quality of life of people throughout our region. Today, the Pan American Health Organization salutes Dr. Jon K. Andrus for his passion, his commitment, and his achievements in the service of health.